Hello, everybody. I'd like to take this time to talk with you about autism. Being a parent is a tough job, but it's even harder when you have a child with special needs or other disabilities such as autism. As parents, we strive to make sure our children are as happy as they can be, doing our best to soothe their fears and so forth. But what happens when your child cannot express themselves normally and cannot tell you what they are really feeling inside? That is just one of the issues I'm facing with my 6 year old, and there are other aspects of my child's behavior that lead me to believe that my child is autistic. When I'm done speaking, I want my audience to understand autism and ways to treat it without medication. I have decided to really research autism because we have been suspecting William of having an autistic disorder, and I have come to terms with the fact that I have been in denial about there being anything wrong with my boy. Last year, my son's teacher called me in for a meeting and suggested that I try putting William on medication to resolve some of his various behavior problems. And that got me really interested in finding alternative ways to treat autism without medication. I don't want to put my son on medication. I don't want to change his personality or dope him up in any sort of way. I just, want him to behave normally and live a normal little life. Some of you might be asking the question, what is autism? Autism is a disorder of neural development usually characterized by impaired speech, impaired social interactions, communication, and behavioral problems. Autism affects the way information is processed in the brain, and people with autism view the world a lot differently than other people. The signs for autism usually begin before the child is 3. Autism affects information processed in the brain by altering how nerve cells and their synapses connect and organize. It is not understood how this occurs. There are different kinds of autism. ADS, Autistic Disorder Syndrome, is a range of complex neurodevelopment disorders. Autistic disorder, sometimes called autism or classical ASD, is the most severe form of ASD, while other conditions along the spectrum include a milder form known as Asperger's syndrome and childhood disintegrative disorder and pervasive developmental disorder. Other common signs of autism are impaired social interaction as early as infancy. A baby with the autistic syndrome disorder may be unresponsive to people or focus intently on one item. A child with ASD may appear to develop normally and then withdraw and become indifferent in social engagement. Children with ASD may fail to respond to their names and often avoid eye contact with other people. They have difficulty interpreting what others are thinking or feeling because they cannot understand social cues such as tone of voice or facial expressions, and don't watch other people's faces for clues about appropriate behavior. They lack empathy. Many children with an autistic syndrome disorder engage in repetitive movements and actions. My son William is a very smart 6 year old. His teachers are just so amazed with his reading and spelling abilities. He reads at a 6th grade level, but William has a lot of behavioral problems and does not behave appropriately when in a social setting. He gets overstimulated when he is in a group of people, and he has a lot of sensitivities to certain sounds. For example, he has meltdowns upon hearing the happy birthday song. We can't sing it to him for his birthday, and if we're at a party at a friend's house, I have to take him into a completely different room, or I have to cover his ears, or else he will just start crying. It scares him. I don't know. It's small things like this that makes me want to take action and do something to help my boy live a normal life. So how can you treat a child with autism without medication? And on to another subject of discussion on the same.